Let's discuss today urine culture test. People also call it culture urine test. Let's discuss now what is culture urine test. First, your doctor tells you they want to do a urine culture. So it's a test to check for germs or bacteria in your pee, in your urine that can cause a urinary tract infection UTI. Your urinary tract includes the kidneys, bladder, and the tubes that carry your pee. An infection usually starts in the bladder or urethra, but it can affect any part of this system. If you have infection, there may be a burning feeling when you pee, or you may feel like you need to go, but nothing or very little comes out. So, if you also have a fever or belly pain, it may mean you have a more serious infection. So, consult about your doctor. How culture test is performed? Let's discuss. Most of the time, the sample will be collected as a clean catch urine sample in your healthcare provider's office or at your home. You will use a special kit to collect the urine, or you will get the container of urine from the laboratory technician or by the flabo. A urine sample can also be taken by inserting a thin rubber tube through the urethra into the bladder. This is done by someone in your provider's office or at the hospital. The urine drains into a sterile container and the catheter is removed. Rarely, your doctor may collect a urine sample by inserting a needle through the skin of your lower abdomen into your bladder, but it's a rarely. The urine is taken to a lab to determine which, if any, bacteria or yeast are present in the urine. So this can take or maybe takes 24 to 48 hours. Now let's discuss what are the symptoms of UTI. Urine cultures can identify the microorganism first. Typically bacteria which causes a UTI. UTIs are the more common in female than males. This is because a woman's urethra is shorter and much closer to the anus. Therefore, it's much easier for bacteria from the intestine to find their way into the urinary tract. And bacteria ascend the urethra into the bladder, ureters, and kidneys, where they can develop into an infection. So most common types of symptoms are below. We have already given. You can check these. Pain and discomfort typically in the lower back and the abdominal area. Pain when urinating, when you are peeing, fever, feeling an urge to urinate frequently, difficulty in your urine stream. So if you have a UTI, your urine might appear cloudy or even turn a pinkish or coral shade. If there is a blood present, even though you may feel a constant urge to urinate, you may have difficulty getting more than a small amount of urine to exit your bladder. In case where the infection is becoming more serious, you may experience shaking, chills, or vomiting. Now come to the main point. When will I get the urine culture result? And what is the positive result mean and the negative result mean of urine culture? Let's discuss one by one. It may take up to the 3 days for the lab to complete the test and send back the result. Your doctor will call you or have you come into the office to review the result. Let's discuss what does a positive urine culture test result mean. If bacteria grow in the urine culture test and you have symptoms of an infection or bladder irritation, it means you have a UTI. This result is positive urine culture test or abnormal test. The lab conducts an antibiotic sensitivity test on the bacteria in the cultured sample, also called an antibiotic susceptibility. So you have already seen in your report what is the mean by susceptibility. So this is the mean what we have already told you. This test identifies the type of bacteria causing the infection and which antibiotics the bacteria is sensitive to, meaning which antibiotics will kill the bacteria. This information helps your provider select the most effective antibiotic medicine for you. But certain antibiotics only work against certain bacteria, and some bacteria have antibiotic resistance. So this is also as well as the problem. So this means the antibiotic no longer can stop that type of bacteria from growing. Antibiotic resistant infection are harder to treat. And what does a negative urine culture test result mean? A negative or normal urine culture test result mean the urine sample showed no sign of bacteria or yeast. You don't have a UTI. The range for normal test result can vary depending on the lab to lab doing the test. If you still have symptoms like painful urination or blood in the urine, your doctor may order imaging scans or other tests. In rare instances, these symptoms may indicate bladder cancer, but in rarely. So you don't take any kind of medicine before anything else happen to you. Okay, so consult your doctor first and don't take any kind of medicine if your results are normal but you are feeling some kind of symptoms. Thank you very much for watching the video.